have one episode safe for surgery when we go. Throw this your way because I think 2 grains are better than 1. Alright, little buddy. We're going to need a new bag.
Later, you feed in here. So he's all set.
Okay, and then and if you just update, the rest should be in there. And if you can grab the knife. Darby.
So this dog is, what are we, 2 months old. Adopted from a pet store 4 days ago. Is Giardia positive and has pneumonia. So came in because he's coughing and very lethargic. So right now we're going to break down the IV catheter to make sure it's patent before we hook him up on fluids. He is oxygen dependent at this point, so that's why we're going to do this very fast. Did they answer those? Please tell me no. Oh, thank goodness. Okay. Have his fluids for this. We're not gonna.
No, you're good.
So Knox was a 5-year-old Goldendoodle who presented to Guardian Veterinary Specialist for acute onset vomiting and some abdominal discomfort. It was determined that Knox actually had an intestinal foreign body that was also partially anchored in the stomach, which means basically that Knox's food and anything that was in his stomach was unable to pass down his intestines and out in the normal way that food is digested. It required us to do some diagnostics to ensure that we knew the location of where this was and to determine whether or not there's any other damage that was associated with this dog eating this. After abdominal ultrasound, we would determine that the foreign body was progressing down the intestines but was also anchored in the stomach. Knox was taken to surgery. We were able to perform what's called a gastrotomy, which enables us to make a small hole into the stomach, and we were able to remove our foreign body out that way. The portion that was entering into the intestines was able to be milked back very slowly into the stomach. So it was all removed that way, which is quite a good way of removing this, as it doesn't require us to make incisions into the intestines. The foreign body consisted of a spoon, which was plastic, as well as what appeared to be a mop head. They were tangled together and were unable to pass down. Right now, Knox has been taken to ICU and is recovering very nicely, and we believe he'll go on to a full, uneventful, lovely recovery.